So those are some of the diagnostic techniques you mentioned. The one that I left at the end is a totally different approach, and it's a radiologic technique. It's called a barium enema, and this technique has actually been around for, I believe, right now, about 70 years, maybe 75 years. And in this case, what happens is you see a radiologist, they have you lie down on a table, and they inject an opaque, chalky substance, which is actually barium oxide in a liquid form. And they actually squirt it, inject it up into your bowel. It's a bit uncomfortable, but it's not intolerable. And what they will do then is they will have you change your position every few minutes or so. And every time you change your position, that contrast agent will fill the inside of your bowel. And what it does is it basically it highlights what is not there. That is, what is air, empty space. And so it gives you almost like an image of absence rather than presence. So what happens is that the X-rays are taken in various positions. The barium moves all the way up through your bowel. Sometimes it can actually be, with enough patience, it can be visualized in the small bowel, so you get a good view of the cecum. And what you're looking for there are what are called intraluminal defects. These are things that actually are starting to impinge on the caliber, the tubular capacity of the bowel. And so in a barium enema that's diagnostic, you'll see an area of bowel that seems to be patent and has, a lot of contrast in it, and then you'll see like a pinch where that bowel is constricted, probably by a tumor around the bowel. Or you'll see bowel that is well filled, and then within from one point to another, there will just be a loop, a little loop of this contrast agent visible on X-ray, suggesting that there's a large polyp or a mass. Now, barium enemas are still an appropriate diagnostic technique, and typically they're available in areas sometimes where colonoscopy is not. So it's an appropriate way to do screening. Although it can be uncomfortable, it still has its place in medical diagnostics for colorectal cancer.